Yes, we are live again. Sorry everyone for breaking the rhythm, but yes, we'll continue with the same topic. So you were asking about, I think, the first question
Advice.
was, yeah, advice for the first year, somebody, right?
Yeah.
First year के लिए advice तो I think Viva will be giving best because she already makes videos about it. So आपको best advice उसी से मिलेगी.
Just study consistently and enjoy your college life, I would say, because these days won't come back. That's it. And for
Perfect.
more details, you can watch my videos.
All right. So now Viva is already in like nostalgic mode that she's soon getting to finish final year. So that is what she's telling. She's giving you advice कि भाई लोग enjoy कर लो. College days वापस नहीं आने वाले हैं.
Yes,
And
sir.
that is true also actually. Yes. Then the next question about third year. Okay, fine. So thank you so much for joining, and you will learn lots of things when you're joining these live sessions because you can visit our previous live sessions also to learn about so many things in the field of physiotherapy. Because I think we have done two or three lives, and that one was especially only about sports physiotherapy, and one more was just to yes know about the normal physiotherapy questions and answers we have done. So I guess yeah, that would be great. So Iba, now when we are talking about, we already spoke about the different options after physiotherapy. Now, what do you think? How much we physios have awareness about physiotherapy? Because that's a real question for me, and I really want to talk about that.
Sir, actually, many of them which I have seen, they go towards some other techniques which are not in our syllabus or not included in our curriculum. So, like needling or cupping. So, I
Right.
don't think that much awareness is there among the people.
But
So,
now,
first,
okay, even I always think about that. But what do you think can be the reason that people are running behind all these techniques?
because the patients demand like मेरे को needling करना है, मेरे को cupping ही करना है. So, but the patients do not know what is the physiology behind it. It is
Right.
the one who we know, like हमें ज़्यादा पता होता है कि as compared to patients कि इससे क्या effects होगा. So first हमें ही aware होना ज़्यादा important है, I think.
And also, can we say that like students are nowadays more fascinated by all these techniques and just for the sake of doing, they'll be doing it, and then after that, they don't care about the result, but they'll just do it,
Yes, sir.
right? And are there still like it's things are happening like during final year or third year itself, they'll start going for treating patients individually or by single-handedly they will handle the patient without informing patient that they are still students like these things are still going on.
Yes, sir. Somewhere or the other चल रहा है. But there is no
Right.
one to stop. But हमें ही खुद को रोकना चाहिए for this.
Yes, so this is what I mean when I say that physios have to be aware about physiotherapy first because unless and until we understand our responsibilities, we understand our ethics and professionalism, these things will never grow. That's the most important thing we all need to understand. Because see, as a ethical practice, as a professional practice, it is mandatory that we have a valid degree first, and then we start treating patients independently. But nowadays, what is happening that what I have observed is every students have that kind of thinking in their mind that no, like we have to earn our money, we need to pay back our parents, we need to spend whatever expenses we are doing, we have to do by ourselves and all. So because of those all things, they start treating all the patients and everything, and then somehow they do injustice with the patient, they do injustice with the profession, and because of
Exactly.
that the profession gets blamed, and lots of things happens because of that. And ultimately what will happen when that student is going for job or working, they will get the reflection of that because they will not get paid well, they will not be respected well. So I think this is something we all start understanding from the beginning, that unless and until you be ethical and professional, it will never change. Things will keep on going in the same circle again and again. And that is what when you spoke about course curriculum, because different techniques people are crazy about. I want to tell this to all the people who are live right now that guys, even if today you just open course and curriculum for UK, you open the course and curriculum for APTA, which is Australian Physiotherapy, then you open curriculum for WCPT, which has been given. There is nowhere it is mentioned that you have to learn needling or cupping therapies. Yeah, because they are actually the therapies which are not exactly science based, so we don't have to really be into that. We have to first learn what is important for us. What are the basic courses that are being taught to us? I know that there are a few courses which are again irrelevant what we are studying right now, and that also has to be changed. It's not like only one way it is. Yes, it is two ways, but we need to correct first whatever is in our hand. Like at least we should not go and learn the different things which are actually not in our scope of practice. So only that is a way we can, I think, resolve this issue. And for that, we all have to come up and understand what is our course and curriculum, and what can be the different techniques that really comes under our scope.
So for that, all the students should be aware of the syllabus कि आखिर है क्या syllabus में. Because most
Yes.
of them हाँ ये कर रहे हैं तो चल हम भी कर लेते हैं, चल देख लेते हैं क्या है. ऐसा ऐसा हो रहा है सर.
यस। और इसमें एक और चीज़ क्या है पता है विभा, कि आई डोंट ब्लेम स्टूडेंट्स कंप्लीटली, क्योंकि अभी स्टूडेंट्स को भी ऐसा है कि यार हमको कुछ नया तो करना है।
हाँ.
अब नया करना है आपको, तो नया करने के लिए यू जस्ट गो टू द थिंग्स व्हिच आर एक्चुअली गुड फॉर पेशेंट्स, एक्चुअली गुड फॉर द प्रोफेशन। लाइक अभी यू आल्सो टोल्ड मी अबाउट दिस कि एआई पे पूरा कॉन्फ्रेंस हो रहा है कि एआई इन हेल्थ केयर। तो
Yeah.
यार ऐसा कुछ सीखो कि मतलब आर्टिफिशियल इंटेलिजेंस का ज़माना आने ही वाला है। तो व्हाई डोंट वी लर्न अबाउट दिस कि अब कैसे फिजियोथेरेपी में एआई को यूज़ करें, कैसे वीआर को यूज़ करें। तो वो सारी चीज़ें हम सीखेंगे। जैसे अभी मेरे एक मतलब मेंटर है डॉक्टर वकार नकवी, मैंने उनके साथ बहुत पहले एक इंटरव्यू भी किया था। ही इज़ एक्चुअली फ्रॉम महाराष्ट्र, बट राइट नाउ इज़ वर्किंग इन गल्फ। He only told me, I have done one interview with him recently also, I'll be posting about that, but he only guided me about it. Ki, see, we cannot completely blame students, but also it's also like about faculties who are guiding students. उनको भी बताना है कि ये सारे ऑप्शंस है तुम्हारे पास, तो गो इन दैट पर्टिकुलर राइट डायरेक्शन। तो अभी आपके पास अगर कॉन्फ्रेंसेस हो रहे हैं आर्टिफिशियल इंटेलिजेंस पे, ज्वाइन करो। मैं खुद भी जाने वाला हूँ, क्योंकि मुझे भी सीखने का उतना मन है। क्योंकि अगर वो नहीं सीखेंगे तो आगे जाके ऐसा हो सकता है कि यार विल बी अगेन द सेम, कि नहीं कुछ नया नहीं कर रहे हो, वही कर रहे हो। तो कुछ नया करने का मन है तो वो करो जो सब एथिकली कर सकते हो
Beneficial.
आप। यस, प्रोफेशनली आप कर सकते हो। यस। एंड एथिकल प्रैक्टिस और प्रोफेशनलिज्म में तो हम बहुत लैक करते हैं, क्योंकि हम वो सब्जेक्ट्स को पढ़ते ही नहीं है। मतलब कोर्स में है हमारे वो सब्जेक्ट्स, पर क्योंकि उनके एग्जाम्स नहीं होती इसलिए हम उसको उतना वैल्यू नहीं देते। द थिंग इज दैट। पर हमें आई फ़ील कि हमें पढ़ना चाहिए वो चीज़ें, क्योंकि उससे काफ़ी चीज़ें इम्प्रोवाइज़ हो सकती है प्रोफ़ेशनली। और ये जो कोई क्वेश्चन पूछ रहा है कि व्हाई सो मच पेशेंट्स आर अवेयर अबाउट कपिंग, तो उसका सेम आई वुड से कि यार जो सोशल मीडिया पे चल रहा है, अभी हम लोग ऐसे नहीं कह सकते कि सोशल मीडिया पे जो भी चल रहा है सब कुछ सही है। और ऐसा भी नहीं है कि सब कुछ गलत भी है। देयर आर सम वैल्यू बेस्ड इन्फॉर्मेशन व्हिच यू शुड फॉलो, एंड जो नहीं है उसको सिर्फ देखो, ज़बरदस्ती फॉलो करने की ज़रूरत भी नहीं है आपको। सिंपल है, इतनी सी बात है। यस।
Sir, in previous live session, you also told me कि read the research papers, मतलब जितना हो सकता है उतना. उसमें से we will gain more knowledge as compared to any other
यस।
things. क्योंकि उसमें proof किया हुआ रहता है. ये हो चुका है, इसका ये result है.
हाँ,
So I
और
think वो भी पढ़.
ऐसा भी है ना विभा कि बहुत सारे आर्टिकल्स आते हैं कि लाइक फॉर एग्जांपल फॉर नीडल्स एंड कपिंग आल्सो देयर आर आर्टिकल्स। पर आप अगर वो अच्छे से पढ़ोगे ना, तो आपको पता चलेगा कि व्हेन दे आर कंपेयर्ड विद अदर ट्रीटमेंट्स, दे आर नॉट एज़ इफेक्टिव। मतलब कैसे होता है ना कि वो ऐसे दिखाते हैं कि नहीं वो इफेक्टिव है। ठीक है, इफेक्टिव है, पर अभी आप कंपेयर करो उसको कि वही सेम कंडीशन में कि मैं फॉर एग्जांपल कोई एक्सरसाइज़ दे रहा हूँ और नीडल दे रहा हूँ। तो आप जब कंपेयर करोगे तो पता चलेगा एक्सरसाइज़ वाला पेशेंट जल्दी ही रिकवर हो रहा है। तो ऐसा नहीं है कि एकदम ही बेकार चीज है वो, पर हाँ ऐसा भी है कि उससे भी बहुत अच्छी चीजें हम ऑलरेडी प्रैक्टिस कर रहे हैं फिजियो, तो फिर क्यों उस साइड जाए ही हम ऐसे, ऐसा है. सो व्हाट डू यू से अबाउट इट?
राइट सर, मतलब चेंज करना चाहिए, बट वी हैव टू
यस.
टेक द इनिशियल स्टेप,
या.
तो ही आगे जाके होगा. Yeah.
एंड अभी कैसा है ना कि रिसेंटली आई हैव रियलाइज कि एज अ प्रोफेसर, एज अ फैकल्टी, हम भी कहीं ना कहीं लैक करते हैं कि यार हम लोग भी ऐसे नहीं कर पाते कि स्टूडेंट्स को ऐसे गाइड करे कि नहीं यार देखो ये टेक्निक से बेटर ये वाली टेक्निक है, जिसके आपको प्रूफ्स दिए जाए कि आप ये जाके सीखो, ये करो. तो जब तक वो प्रोफेसर से नहीं आएगा ना तब तक स्टूडेंट भी नहीं करेंगे, क्योंकि ऐसा होगा कि जो कॉलेज में सीखा है वही वो बाहर जाके करने वाले. तो कहीं न कहीं वो चीज़ें भी हमें इम्प्रोवाइज़ करनी है. वो मैं रियलाइज़ किया हूँ, आई थिंक आई एम गोइंग टू डू इट डेफिनिटली, एंड स्लोली बहुत सारे लोग भी करेंगे ये चीज़ें, ताकि इस चीज़ में एक बदलाव हम देख सकें, जो सर्कल में चीज़ें चल रही है वो स्टॉप हो जाए. क्योंकि बहुत सारे मतलब जो प्रोफेशनल्स हैं, जो मेंटर्स हैं, वो ऑलरेडी बोल रहे हैं कि मतलब ये सारी चीज़ें कैसी है कि 5 10 ईयर्स में गायब हो जाएगी, पता भी नहीं चलेगा. जैसे कपिंग, नीडलिंग वगैरह हम जो बोल रहे हैं. क्योंकि उसका कोई एक्चुअल में इफ़ेक्ट पेशेंट्स में नहीं हो रहा है। पर हाँ, द थिंग्स व्हिच आर गोइंग टू कम अप आर लाइक आर्टिफिशियल इंटेलिजेंस, एआर, वीआर, वो सारी चीज़ों पे अगर आप फ़ोकस करोगे तो डेफ़िनिटली आप कुछ नया भी करोगे और पेशेंट को बेटरमेंट भी दे पाओगे। येस।
वी हैव टू लर्न द यूज ऑफ एआई, मतलब एआई को हमारे लिए कैसे काम करवाना है, उसके बेसिस पे ही वी विल बूम इन फ्यूचर.
I think when we spoke, I told you about one thing, right? That till now we are using AI, मतलब चैट जीपीटी हम
या
सब यूज़ कर रहे हैं। हाँ, पर प्रॉपर्ली यूज़ करना हम नहीं जानते, वो हमें सीखना पड़ेगा। वो सीखना है बस, सिंपल सा लॉजिक है. और आजकल मतलब कैसा है कि अगर हम जल्दी सीख जाएँगे तो शायद हम लोगों को सिखा भी सकेंगे, ऐसा है.
राइट सर.
यस. एंड अबाउट द पीपल हू आर डूइंग होम विजिट्स फ्रॉम देयर कॉलेज लाइफ, तो आई रियली सजेस्ट कि डोंट डू दैट, क्योंकि दैट इज़ नॉट रियली योर bread and butter right now. Right now, your work is to learn as much as you can, to get exposure as much as you can, to get skilled as much as you can. Internship is the time when you start experimenting, and after that, you know now that okay, what has to be done for the patient, because your patients are actually not guinea pigs. They are actually human beings. You cannot just go and experiment something and come back. Yeah, sometimes it works for us, I know that, but most of the time it will happen that they will not get benefits out of it, and they only will tell that physiotherapy is not good, and ultimately it will come back to you only. So don't do that.
Because complete knowledge we are not having till we complete our internship.
True. And also now, I think somebody asked me about it, like, sir, what about manual therapy and mobilization? So what is your views about it, whether it is old, ancient, or it should be practiced right now also?
If we are certified in it, so we can practice because we have completed the course, we have learned the proper forces, biomechanics behind it, then we can practice it. But ऐसे ही without certification, I don't think it's ethical or we should practice it.
Right.
Because
So for that also, like our course has subjects like we are learning Maitland's mobilization. Yes. And in few colleges, professors will teach about it. Okay, if you want to learn more about Mulligan's concept, you want to learn more about Mackenzie's concept, they will teach about it. Definitely, if you have learned like that and you have practiced it under proper observation, do it. And it is not outdated, guys. It's still working and it's still doing good things for the patients. Yes. Um. Okay. Now somebody is asking, can you suggest some workshops which will help in clinical practice more? Sure. There are many workshops like just now Viva told that manual therapy, and other workshops are going on, but make sure that you're not doing again in this also conflict of interest comes when you are doing something out of your scope, like chiropractic. People are going crazy about chiropractic in the names of mobilization. So that is not exactly mobilization. For chiropractic, you must do minimum 6 months of course. If you're doing 2 days of some workshop and calling yourself a chiropractor, then you're stupid. Don't do that.
So
Okay.
there are many places in village side, like they just put on the banner that we are physiotherapist, and the villagers, the normal people, they are not aware कि अच्छा इसके पास अच्छी डिग्री है, लाइसेंस है, यानी लिखा है तो होगा, चलो जाते हैं. But this incidents happened recently in our area. So पेशेंट जा रहे हैं, पूरा फ्लो बढ़ रहा है, बट दैट पर्सन हु इज नॉट हैविंग द लाइसेंस एंड ही हैज नॉट completed the course, but he assumes himself that I am a physiotherapist, and there is something called naturotherapy. I don't know exactly about it.
Hmm.
So we dono courses, we combine the both of them, and we give therapy. Yes, you will be cured. Like one patient, he was in his PIVD stage 4. So
Hmm.
मतलब सर्जरी रिकमेंडेड था वो पेशेंट को,
Hmm.
बट स्टिल द दैट पर्सन वाज लाइक नहीं नहीं हम ठीक कर देंगे, आ जाओ.
That's
So
what.
this is
So
also.
yeah. So this is like lack of awareness from patient side as well as the therapist side. अभी कोई पेशेंट भी जाके कभी पूछता नहीं है थेरेपिस्ट के भाई तेरा सर्टिफिकेट तेरा डिग्री क्या है, राइट?
Yeah.
So I think now we all should start doing that. Like when you go for treating patient, we have to tell, okay, I'm like for example, how we do in the practical exams. Like first we go and introduce ourselves to model that I am so and so, I am in final year student and I'll be performing this. So if you have any discomfort, please let me know. See, this is again when I told that ethics and professionalism, we should learn about it. We are simply ignoring it because we don't have to give a exam of it. But if you study that, you will know about it, that we should introduce ourselves that way. So when you start doing that, definitely patients will understand, yeah, okay, the real therapist who is there, they will have a degree, who have completed a degree, and then they will be performing certain, and they have some ethics and professionalism. These people, what you're talking about, they will also walk on their back and they will do some nonsense things also, and still patients will let them do it. Right? Like how we see certain videos of like hallelujah and all, some things
Yeah.
people are doing. Yeah.
वायरल भी हो जाते हैं सर, मतलब हाउ
So it's like that's why I mentioned like social media gives you so many things. You need to validate it and then you have to believe it. Simple as that. What should students do after completing BPT? Join hospital or MPT, which will be good, and your opinion on it. Well, you can do anything. You can join hospital also. You can do MPT also. As the starting of the live session only, we discussed about it. There are various options. It's not compulsory you do only MPT. It's not compulsory you only do hospital. There are many things you can do. So I would say that keep exploring and make sure that whatever you do, you have interest in it. Is it difficult to do MPT at Australia? Yes, it is difficult. Physiotherapy and chiropractor are same. Can I do chiropractor after physiotherapy? Oh God, no, it's not same. It's completely different. If you want to do chiropractic, then you do minimum 6 months of course. Then only you do it. कंटेंट क्रिएशन फिजियोथेरेपी वीडियो बहुत चल रहा है भाई. अगर तुम्हारे पास स्किल्स है तो करो. डेफिनेटली करो. Can you please suggest some workshops on improving clinical practice? I think I just did. You can just go back and see that session. Apart from that, if you have any questions, you can keep asking us. There is one question for you, Viva, which is like, which year was more hard for you? First, you go for it, then I will tell about it.
ओके.
Yes.
सो इनिशियली फर्स्ट ईयर थोड़ा डिफिकल्ट लगा मुझे, क्योंकि तभी सब कुछ नया नया था. जस्ट ट्वेल्थ पास आउट थे, नीट दे के आए थे. सो कैसा स्केड्यूल रखना है, कैसे पढ़ना है, उसका इतना आइडिया नहीं था. सो यस, जैसे जैसे इयर्स पास होते गए, आई गॉट एन आइडिया कि ओके ये स्ट्रैटेजी है, इसको फॉलो करना है. एंड मोस्ट इम्पोर्टेंटली हमारे सीनियर्स, दे हैव हेल्प मी अलॉट. मतलब सीनियर्स, बहुत मदद हुआ है उनसे.
सीनियर्स
एंड
होना
फिर
जरूरी है.
सर.
सीनियर्स होना बहुत जरूरी है.
सीरियसली एग्जैक्टली मतलब जो लास्ट मोमेंट टिप होता है ना एग्जाम के लिए कि ये कर ये कर ये कर, दैट इज वेरी इंपॉर्टेंट. तो
True,
यस.
true, true. Yes. I think according to me also first year is the most difficult year. क्योंकि जैसे विभा ने भी बोला लाइक यू आर इन अ न्यू कॉन्सेप्ट, यू आर इनटू समथिंग न्यू, एनाटॉमी आ जाता है, बायोमैकेनिक्स आ जाता है, मतलब यू आर already not into that zone. So yes, it's a little difficult, but once you just go with it and you start understanding the concepts, then second, third, final year, I think yeah, you already know what to do about it. So first year will be the difficult, I would say. Somebody's asking about APC exam. So APC exam is like Australian Physical Therapy. This exam is there. And for this exam preparation, mainly you need to know proper assessment skills, differential diagnosis skills, as well as how you give treatment. So everywhere other than India right now you go, they focus more on patient safety. So how safe you keep your patients, that is their priority. So whichever case you are getting, you have to think in that direction that patient has to be the safe. That should be your first priority. Second priority should be that you are making a good diagnosis, like you know proper differential diagnosis of that particular condition, and then you are coming to one point. And the third point comes that your rehabilitation protocol, how you are designing it. And if you really want to prepare for it, there is a series on my channel, Physio Quest. You will find so many questions relevant to like real time case scenarios. And from that, you will learn a lot about like okay, what can be the assessment skills, differential diagnosis skills, and everything. And then that will help you for the exam. Yes. Okay, tell us how to give practical exam. What examiner expects from students, and some tips from your side. So Viva, you have given already three vivas, right? Final vivas, practical
Yes,
viva.
sir.
So you tell us how do you prepare for viva, and what do you think examiners will be expecting from the students?
सर मतलब ऑनेस्टली एग्जामिनर्स दे वांट द बेसिक्स, दे वांट टू नो योर कॉन्सेप्ट. आई थिंक मतलब अगर हमारा कॉन्सेप्ट क्लियर होगा तो वी विल बी एबल टू आंसर इट इन वन गो. वी विल नॉट नीड टू थिंक कि अच्छा ऐसा होगा ऐसा होगा. अगर रट्टा मारा होगा तो ऑफ कोर्स नहीं आएगा, बट अगर हमारा बेस क्लियर है तो वी कैन आंसर इट प्रॉपरली.
Perfect. Yes, you are actually right. Being an examiner, for example, if I am going for examination, yes, I look for. See, it is always like in examiner's mind, it is like ratio of 70, 20, and 10. 70 percentage questions they will be asking mostly about the basics. Then 20 percentage they will ask a little bit complicated questions. If you answer 70 percentage of the questions, then the 20% will come. And last 10 percentage will be like the difficult questions which you might be able to answer, might not be able to answer. So examiners, like as an examiner, how I prepare is like 70% of the questions which are easily to be answered, 20% may or may not be answered, and the 10% will be difficult to answer. So that way the examiner prepares. And the most important thing for examiners is your discipline and manners. Even though you're not answering, okay, fine, they will still let go you. But if you are indisciplined, if you are not mannered well, then boss आपको वो जो 10% difficult question है वही सबसे पहले मिलेंगे and you will be caught. So that's my tip for you all, that at least be mannered and disciplined when you're going for Viva exams. Right, Viva? You
Yes,
must
sir.
have seen no, your batchmates getting screwed sometimes because of
Yes.
attitude
Answer.
what they have. Yeah. So yeah. So examiners don't like basically your attitude at that point of time. Yes. Mm. Okay, somebody is asking for first year classes video. I think Kishore, you should visit Vipa's channel for that. There are lots of videos she has uploaded about first year, second year, third year. So you will learn a lot from that. And there are a few videos on my channel too, but I think she has uploaded maximum of that. To do MPT, is it compulsory to answer entrance exam? Yes, if you want to do it from good colleges, good universities, it is compulsory. If you just want to apply for MPT in some colleges, places where entrance exam is not there, that option is also there. But yeah, most of the places, good places, you have to apply for entrance exam.
सर फॉर महाराष्ट्र ऑल्सो देयर इज पीजीपी सीईटी जो अभी 1 सितंबर को ही होने वाली है.
Oh,
बहुत
okay.
डिले हो गई है, तो अभी फाइनली
Okay.
डेट आ गई. या
So first September is the PGP exam for people who have completed internship.
या
Okay.
वो मई में होने वाली थी सर, उसके बाद जून में हुआ डेट. अभी फाइनल डेट 1 सितंबर आ गया है. इतना डिले हो
All right. So almost 3 months it got delayed.
गया. या
So I understand the people, students who are preparing for it, how frustrating for them it will be because they must have prepared, then again got delayed, delayed, delayed. But yeah, all the best for all the students who are appearing for it. I really wish that you will be having a good, yes, good scoring marks in that exam. Okay, somebody's asking how much do you know about government bodies control physios? What are government governing bodies? Well, right now in India we have this NCAHP, which you should know about, National Council of Allied Health and Professionals, under which physiotherapy comes, and the work is going well. I would say, though it was passed the bill in 2020, but yeah, right now it's going really good. Maybe by the end of this year, we will see that all the states will be having their branches, and lots of changes might come. And if you want to know more about NCHP, I have made 2 videos about it. That also you can see. Pravara Institute of Medical Science. I think that's a really good college. Viba, have you heard about this college? Your voice is not coming, Viba.
सर इज इट कमिंग
Yes,
नाउ?
now it is coming. Perfect. Yes.
So, it's a Pravda University. It's a deemed university, and I have visited there for a conference which was held in 2022. It's a good university, but वहाँ पे भी मास्टर्स हो चुके हैं अगले 2 साल के.
Oh wow. No, already it's booked. Nice. So yeah, it should be a good university. Then only people are like pre-booking it. Maybe perfect.
Recently, they have started masters for sports also. Sports MPT in.
Perfect. Nice. Mm, so which hospitals are better for internship, government or private? What do you think?
हॉस्पिटल्स फॉर इंटर्नशिप. तो गवर्नमेंट में ज़्यादा पेशेंट्स देखने मिलते हैं आई थिंक, क्योंकि थोड़ा कम मतलब पैसों में हो जाता है ट्रीटमेंट.
Very honest answer. Nice. I like that. Yes, so that is like in terms of exposure, definitely government hospitals you have very good exposure. But if you again look at this, private hospitals will give you proper guidance to professionalism. So I would say do 50-50 if it is possible.
यस
You
सर.
know, yeah, because professionalism really matters a lot. If you don't have it, it's like what we can have pav bhaji in street also. We can have in 5-star restaurant also, 3-star also, 4-star also. And we know that obviously on street it is more tastier, like when you go to eat it. But when you want to sit calmly and enjoy it, you go to some good hotels. So same way, if you have professionalism, you will get good that kind of clients or patients. So it's all up to you. So I would say mix it up because exposure is very important to learn and upgrade your skills. Same time, even the professionalism is important. All right. So Rajo, Vanul, Parvez, Ronnie, thank you for watching from Bangladesh, buddy. And academic excellence is something new which I have heard. Yeah, that is actually something new and it should be implicated for everyone because I guess now every colleges are going to start with like faculty development programs. So faculties have to also attend certain things modules so that they can give better education to our students. And for that, yeah, lots of things should come up like changes in courses, curriculum, everything. But yeah, things will start in that direction soon. Yes. और बताओ विभा, कई लोग ये कमेंट्स में ऐसे लिख रहे हैं कि मतलब इंग्लिश में बोलो, कई लोग बोल रहे हैं हिंदी में बोलो. सो व्हाट शुड वी डू इन दिस नाउ?
Both English and Hindi.
राइट, ये इंग्लिश हिंदी के चक्कर में ना कभी हम ये हो जाएंगे. मतलब एक काम करेंगे, विल कीप अ सेपरेट लाइव सेशन फॉर हिंदी, विल कीप अ सेपरेट लाइव सेशन फॉर इंग्लिश आल्सो.
Yeah, that would be better.
Yes. Okay, one interesting question, how many types of therapist do you know?
Like in physiotherapy or some other field?
You can tell anything, like, because it is written over here in the comment section. Playful Mind has asked Piyush Mehta.
Therapists, there are physiotherapists, and
Okay. I'll tell you, like, see, like, there are physiotherapists who will be like completely into showing off. They'll come to the clinic, they will just like show that they know everything, but they will ask all the other physios to do the work. Like that, therapists are there. Then there are certain physiotherapists who are like they cannot say no to patients. So we have that situation all the time that patients will come with that one prescription from orthopedician or somebody stating that you have to give stability, traction, and everything. Then they will simply follow it without like even understanding whether they really require stability or traction or not. Because of course we physios have assessment skills. We do assess patients, and after that we decide about what modalities we should give, not the other doctors will decide that.
yeah, because we know the physiology and mechanism behind it, so we could give it in a better way.
Exactly. So there are different types of people like that. Anyways, now for so when we speak about physiotherapy, knowing physiotherapy awareness, so we talk about this again. Few more points are there that we should discuss. I think that when you are practicing physiotherapy, and there are certain times it will happen that that condition is out of our scope. So what exactly should we do in that particular time?
Okay. So, like example, can you give?
Example, let's create a situation that patient has come with low back pain. We tried assessing the patient with their history. History patient is telling that it has suddenly started. There is no trauma. There is no activities that patient has done. Then we go for observation. We find out that yes, mild inflammatory signs are there, and patient's range of motion also a little bit restricted. Then we go for examination for the examining the same points of time. Tenderness is present over the back, and it is not like ki only active movement is causing the pain, but also passive movement is causing the pain. Also resisted is causing the pain. Patient is getting pain at rest also. Patient is getting pain at activities also. We perform special tests. All the special tests are coming positive. Like slump is also positive, SLR also positive, Faber also positive, and or let's say that none of them are positive. So in this situation, what will you think that what we should do?
So, because all these things, it is difficult to come to one particular diagnosis. So, I think we should ask the patient to get the MRI done so that it will be confirmed कि ऐसा कुछ है.
Okay, see now. Okay. So, okay, you thought in that direction. Good. So, at least you will not treat that patient immediately, but you will mention patient that you should go for some other reference, right?
Yeah, yeah.
Yes. So that's what I was trying to come to the point that what happens now in such situations that it will happen to any therapist. Like for example, tomorrow I start a clinic, and tomorrow I get five patients and I'm treating them. Next day I'm getting only three patients. Day after that I'm getting again five patients, but I want more patient. And in that one patient is like this, and without even thinking about referring patient to somebody else, I just simply start treating the patient. Now imagine what if that patient had a tumor in the spine,
Mm.
and you are giving some superficial eating modalities, you are giving some range of motion exercises, and after certain period of time, like 1 month or 1.5 month, the pain increases suddenly, and then patient goes for scanning and they figure out that there was a tumor and now it is spreading to other parts of the body. Now whose mistake it is?
It has started by us
Yeah.
because we now started.
Exactly. So what situation I gave, it was typically a situation in which you will see the patient who are having any, I would say, carcinogenic conditions, or it can be related to some organ-related injuries. Because when you have soft tissue-related injuries, you will see that active movements will cause more pain. If it is related to something like any trauma, so history of trauma will be there. Then if it is something like other structures are, like spine is involved, then definitely certain movements will give you confirmation of the pain, like special tests when you do it. Now none of this is getting confirmed, then it is definitely out of your scope. So in this particular period of time, we consider them as a red flag for physiotherapy treatment, and we have to send them to reference for any physician who will be asking them to undergo some scanning. They will confirm there is nothing wrong with it. Then only we should again take that patient and start reassessing the patient. So this is the kind of awareness we physios have to raise amongst us also. That if such cases are coming to us, don't try to treat them immediately. At least give them some time, refer them, and once they are confirmed they are not having any of the red flag situation, then only you treat them. So there is something called green flag, red flag, and yellow flags,
Yellow
which we
flags.
learn already in I think assessment also, but we forget to practice it when we are actually practicing it. All right.
Yes.
Yes. uh, I thought when patient is having sciatica and cervical spondylosis or a lumbar spondylosis, that chiropractic is effective, because I saw the video on you that doctor just do whole body alignment and patient is okay. Yeah. So that's what on the videos what you're seeing that might not be correct. Again, always know the value of that content, how much accurate
Mm.
it is. Don't believe them directly.
Real versus real.
Yes, I think we all have made that kind of videos. Like Viva also has made, even I have made. What is the difference between chiropractic and physiotherapy? How physiotherapists are helping you much better way in compared to chiropractic, and how chiropractic can be dangerous for you also sometimes. So please go through them in a scientific way. Uh, this is very interesting question, that how to get job in private hospital. Can I get a job without any connections? Yes, you can, I think. If you have skills, if you are knowledgeable, then you can get. Without skills, nobody will hire you. And if with connection you get hired also, it is of no use. So don't even think about that. Yeah. It will be again headache for patients, headache for management, because you don't know anything. So always work on your skills, upgrade your skills, and that will work for you. Yes. So I guess this is enough for today's live, Viva. We have discussed a lot of point. If you have anything to include in this, or if you want to add anything to this, please go ahead.
No, sir. At such comments, maybe we have covered all the comments, I think.
Perfect. So next live session, क्या topic पे रखना है? Anybody has any suggestions? Please let us know in the comment section. We'll wait for your suggestions for 5 minutes. And I guess by that time, even from our point of view, also what all live we can do, we can discuss about that also. Like any next live session, do you have you thought of any topic for next live sessions?
सो मतलब काफी लोग पूछते हैं कि एडमिशन प्रोसेस के बारे में ही पूछते हैं कि कैसे एडमिशन लेना है so, उसके ऊपर भी आई हैव मेड अ वीडियो बट इन डेप्थ अगर और लोगों को चाहिए तो वी कैन टॉक अबाउट इट
परफेक्ट एक्चुअली इट्स रियली इम्पोर्टेंट, क्योंकि अभी एडमिशन टाइम भी चल रहा है तो काफ़ी बच्चों को वो कंफ्यूजन होगा. तो लेट्स डू दैट. आई थिंक नेक्स्ट वीक वी कैन डू अबाउट इट, एडमिशन प्रोसेस. और We will do little early. We'll not wait for the Saturday or Friday. तो अगर मंडे ट्यूसडे वेडनेसडे में कभी भी अगर फ्री है तो आई थिंक ये भी और साथ में बेस्ट कॉलेजेस पे भी हम एक वीडियो मतलब लाइव सेशन कर सकते हैं राइट
Yes, sir. On video
यस
assessment, we have did a live on orthopedic assessment. You can check our live
यस वी
for
हैव
that.
ऑलरेडी डन दैट लाइव सेशन so you can check that out. It will be there in both of our profiles, so you can just go subscribe our channel first, and then you can check it out.
Yeah.
Yes. And then, how is your channel growing, Viva? Like, how is it going with your channel?
So it's going thoda moderately. It's not just flying, but chal raha
ठीक है, चल रहा है तब तक okay, fine, good, nice. Same thing with me
hai.
also actually. Lots of views comes, but subscriptions are less.
Exactly. Subscribed people there only 20 to 25%. Rest all they are not subscribed to the channel.
True. और उसका कोई solution पता है तुम्हें?
So we just have to keep telling subscribe.
Right. Even I am like that only. मतलब क्या करेंगे पता नहीं ठीक है पर जब तक जितने सब्सक्राइबर्स हैं उनके लिए तो बहुत बड़ा थैंक यू because you
Hmm.
have really understood the value of our content. So thank you so much for that, and keep sharing with your friends so that even they will get benefited from that. Yeah,
So what about your physios and mountains? Would you like to share something?
sure. So Physios on Mountain is actually very close to my heart event. I have thought about it like for this World Physiotherapy Day celebration. It is something different rather than going for any conferences, workshops, because this time we are targeting to make connections and networks with other physios coming from different parts of India. कि यार आओ मिलो बातें करो बताओ कि लाइक कैसे तुम्हारे वहाँ पे प्रैक्टिस चल रहा है क्या तुम कैसे इम्प्रोवाइज कर रहे हो या फिर किसी स्ट्रगल वाली सिचुएशन में कैसे उससे बाहर आ रहे हो तो मतलब इट्स लाइक शेयरिंग ओपिनियंस like how we are sharing opinions over here but it will be live and that too on a very beautiful location that's really matters तो एक छोटा सा ब्रेक भी होगा हमारे लिए और नेटवर्किंग भी करेंगे क्योंकि फ्यूचर में आई फील इज कि आगे जाके ऐसा ही होगा कि यार कल जाके मुझे फॉर एग्जांपल मनाली जाना है या फिर मुझे हैदराबाद जाना है या चेन्नई जाना है तो मैं किसी ना किसी फिजियो को वहाँ पे जानता हूँ और उसके साथ जाके मैं डायरेक्टली कुछ शुरू कर सकता हूँ तो आई फील कि जो यंग फिजियोज है जो अभी शुरुआत कर रहे हैं उनके लिए बहुत बढ़िया सा अपॉर्चुनिटी है टू लर्न एंड टॉक अबाउट दिस एंड प्लस यस वर्ल्ड फिजियोथेरेपी डे है तो उसकी भी अवेयरनेस के लिए भी हम लोग मिल रहे हैं अब मेरा पहला टारगेट तो यही है कि फिजियोस में अवेयरनेस लाना है उसके बाद पेशेंट्स में लाना है तो दोनों ही चीजें वहां पे हो जाएगी तो इन अ वे यस इट्स गोना बी अ वेरी फ्रूटफुल इवेंट
Yes, sir.
ऑलरेडी एक्साइटेड फॉर इट हमने एक और मीटअप भी प्लान किया है वहाँ पे लाइक 6th को हम लोग वहाँ पे डी कैथलॉन देहरादून में मिल रहे हैं सब लोग तो अगर कोई देहरादून से है तो वहाँ पे आ सकता है इट्स अ जस्ट मीटअप इज देयर वी आर गोइंग टू प्ले cricket and different games in decathlon for 2 to 3 hours so again that is going to be a fun activity session for all the physios and whoever is coming with them तो ऐसा है
So I want to come, but I don't know.
it's okay if situation permits time permits definitely you should come नहीं तो
Yeah.
फिर कभी ना कभी कुछ ना कुछ तो करते रहेंगे बट या these are the opportunities actually like very rarely we get and that's why I said like this is some kind of different event that normally we will not see in physiotherapy group so we should keep on doing this next time maybe we can plan something together
Yeah. So do plan something in Mumbai. I'll be definitely here.
okay done we'll think of something actually Mumbai already बहुत crowded है ना यार
हाँ है तो सर बट
अच्छा कोई अच्छा लोकेशन एक काम करो यू ओनली फाइंड आउट एंड देन विल प्लान समथिंग इन दैट डायरेक्शन
ओके
कि जहाँ पे physios can meet up and you know like just share their point of views so maybe that sounds like a good idea actually because obviously yeah so many physios are there in Mumbai सब मिलेंगे तो it will be a great event for all of us
यस सर
तो वो ढूंढ के रखो, कोई जगह मिलेगा तो डेफिनेटली विल थिंक अबाउट इट.
Yes, sir.
ठीक है. Yes.
Yeah.
And somebody is asking your channel's name, Viva.
Vibha Raibakar. It's my full name.
Perfect. And you will see that in I will provide the link of her channel also in this live session, so you will find it from there also. Or else you just type her name and you will get her channel.
Yeah.
All right, guys. Then thank you so much for joining. Thank you so much, Viva, for joining this session and
Yeah.
initiating this session. Perfect, it was. See you soon with the topic of admission process and good best colleges in for physiotherapy. All right. Yes. Bye bye. Good
Thank
night.
you. Good
Yes.
night.